If you want to know why adults or children with complex cerebral palsy need 24-hour critical care nurses, stay tuned. I've got news for you. My name is Patrik Hutzel from intensivecarehotline.com, and I will explore today why complex adults and children with complex cerebral palsy need 24-hour critical care nurses in the home. And that is what we provide here at intensivecareathome.com. So we have looked after many cerebral palsy clients over the years, adults and children who are very complex. They usually are on BiPAP. They're on and off BiPAP, or they're ventilated with a tracheostomy. They have often seizures. They have PEG tubes. They're unfortunately often blind, and also have hearing loss. So therefore, they are in need of 24-hour nursing care. And quite frankly, if they can't have 24-hour nursing care for whatever reason, they often die, as we have seen many times here at Intensive Care at Home, where we have provided critical care nurses to cerebral palsy clients that are very complex for some hours, but not 24 hours. And then they often have passed away, and when we were not there, just as we predicted during those times. So today, I want to actually focus on one of our cerebral palsy clients, of course, completely anonymous, and one of our nurses who's working there. She writes fantastic reports. And I just want to focus on her report of a shift, so you can actually see what we can do for you if you have a loved one with cerebral palsy, either at home or in hospital, and you want to go home because you need 24-hour nursing care to get your family member home from hospital, or if you're at home and you can see that whatever you've got at the moment is not working, your loved one is at risk of going back to hospital, back to ICU, or even worse, potentially dying, having medical emergencies. We've seen all of that. So I just want to read out a shift report from one of our nurses who's working with a very complex cerebral palsy client. It also goes hand in hand. They often can't cough. They need airway clearance, but it'll come clear in the report. So inserting nasopharyngeal airway and oropharyngeal airway for frequent suctioning of increased thick, clear, creamy secretions. So what that means is an NPA is a nasopharyngeal airway. It goes into the nose, and an oropharyngeal airway goes into the mouth, and it is a guard so that you can do deep suctioning in the lungs, because unfortunately, complex cerebral palsy clients, or many, can't cough up their secretions. And if those secretions are not being suctioned, they end up with pneumonia, and they end up in ICU, or either on a ventilator or potentially even worse, right? So that's why you constantly need to keep an eye on that, and you constantly need to assess the unstable airway, which is also a symptom of someone with complex cerebral palsy. Now, our nurse gave hypertonic saline. Hypertonic saline helps to loosen up secretions, and then it's easier to suction out secretions. And Astreonam 500 milligrams given. The client is continuously monitored with saturation and heart rate, and desaturated frequently to 87 to 92%, requiring frequent suctioning and chest physio, which was effective. And this is exactly the point, You need to constantly know how to manage an airway that is compromised. It is compromised through thick secretions, but it can also be compromised through regular seizures. Because if someone is having regular seizures, especially with cerebral palsy, chromal, tonic-clonic seizures, the airway becomes unstable. They might vomit, and then they might aspirate, which could once again lead to a pneumonia and hospital and ICU admission and intubation or worse. Tachycardia, 100 to 125 beats per minute, and eventually saturation improved to 90 to 94%. But then the client was put on BiPAP. BiPAP is mask ventilation. Increased flickering and 11 atonic drop. Seizures were witnessed, but no absent seizures. So they are really significant seizures once again. Temperature 37.9 at 6 p.m. PRN ibuprofen given. The PEG is leaking copiously. So, a PEG needs to be changed as well, checked as well, especially if it's leaking. So the balloon needs to be checked. The PEG might need to be changed. If it's leaking, the size might need to be assessed. Again, those are all skills of critical care registered nurses. Then Dressing on sacrum was changed and pseudocream applied. Polyuric, which means good urine output, having increased. Double maintenance fluids to reduce hypercalcemia continues. Abdomen slightly distended, bowels not open with minimal discharge. Stage 1 pressure injury to the sacrum remains unchanged with massage and decreased chair time. Skin breakdown to right axillary improving. Once again, pressure area care cannot be managed by a support worker, needs to be managed by a registered nurse. All personal care attended. All feeds, flushes, and medications were given. The client showed signs of discomfort with increased tummy smacking during the routine walk, which settled. Bloods collected, calcium 3.32 millimoles. Plan to continue hydration as needed. Bloods are being monitored daily while there are electrolyte imbalances. So that concludes the report. And once again, you can see that we can manage all of that at home, but it does require the skill of an intensive care nurse. It's pretty much like a shift in intensive care, just that we do it at home, in the comfort of your home and in the comfort of your family member's home. It's a much better environment. And just in case you're watching this and you have a family member with cerebral palsy in a similar situation and you don't have the nursing support, but you have an NDIS package, or you have private health insurance or whatever, we can help you with the funding. We have implemented 24-hour nursing care with critical care nurses for those situations with NDIS or other funding bodies, just simply through our advocacy, knowing what to advocate for, but also understanding NDIS funding in particular, but also understanding other funding bodies, right, including, once again, private health insurance. So it is all possible. We've turned many of those situations around where families can now have a break. They can now go on holidays. They can go back to some sort of normality, whereas beforehand they were living in hospitals, they were living in ICU. They were constantly living on the edge because they didn't know how to manage their family member correctly, or, so that they could keep home or stay home predictably, because that's really the crux of our service, that we keep our clients at home predictably. And I think that is really important for you and peace of mind for you, that we keep our clients at home predictably, not just when things are easy. We can manage those situations at home. Our clients, generally speaking, do not go to hospital, especially with 24-hour nursing care. But if they don't have 24-hour nursing care with critical care nurses in situations like that, it is very difficult to keep them at home. It is also very difficult to keep them alive, because we've seen, unfortunately, quite a few cerebral palsy clients die if they didn't have the 24-hour nursing care. It is a shame. But that's why I'm making this video, so that there's help out there, whether it's with the nursing or with the funding. We are here to help. Now, with intensive care at home, we're currently operating all around Australia, in all major capital cities, as well as in all regional and rural areas. And we're sending our critical care nurses into the home 24 hours a day. Therefore, we are providing a genuine alternative to a long-term stay in intensive care for ventilation and tracheostomy for adults and children. We're also providing intensive care at home for home BiPAP, home CPAP ventilation, as well as ventilation without the tracheostomy. So, we're also providing tracheostomy care at home without ventilation, home TPN, home IV potassium infusions, home IV magnesium infusions, as well as peak line management, central line management, Hickman's line management, as well as a portacath management at home. We're also providing ventilation weaning at home. We're also providing nasogastric tube management and PEG tube management at home. We're also providing palliative care services at home. We're also sending our critical care nurses into the home for emergency department bypass services. We have done so successfully as part of the Western Sydney Local Area Health District, their In Touch program, saving approximately $2,000 per patient that we keep at home instead of going into an emergency department. We're also cutting the cost of an intensive care bed by around 50%. The intensive care bed costs around $5,000 to $6,000 per bed day. It is the most expensive bed in a hospital. It is also the most sought after bed in a hospital. Our service costs around 50% of that, and we're freeing up the most sought after bed in the hospital, which is the intensive care bed. Most importantly, we're improving the quality of life for patients and their families So it's a win-win situation for everyone, for all stakeholders. With intensive care at home, we are an NDIS-approved service provider all around Australia, TAC and WorkSafe in Victoria, iCare in New South Wales, NIISQ in Queensland, as well as the Department of Veteran Affairs all around Australia. Our clients and we as a provider have also received funding through public hospitals, private health funds, as well as departments of health. We are the only service provider in Australia in 2025 that has achieved third-party accreditation for intensive care at home nursing in 2025. We have been achieving this high level of accreditation since 2012. No other provider has achieved this high level of accreditation in the community in Australia and has created more intellectual property for intensive care at home nursing than we have. This puts us in a privileged position to employ hundreds of years of critical care nursing experience combined in the community. No other service provider in 2025 employs a higher skill level in the community than we do, which enables us to look after the highest acuity adults and children in the community in Australia safely. Now, if you're at home already and you're watching this and you realize that you don't have the right level of support, or if you're stuck in an ICU and you're watching this, or you have a family member stuck in ICU or at home, I'll give you an example today how we can turn this situation around. One of our first clients over 10 years ago was a client who was at home on a ventilator with a tracheostomy with a support worker model 24/7. Of course, support workers cannot look after a client at home on a ventilator with a tracheostomy. That is like flying the airplane with a cabin crew instead of the pilot, because anyone on a ventilator with a tracheostomy is at very high risk of medical emergencies or dying if they don't have critical care nurses at home looking after them 24/7. As is evidence-based and documented in the mechanical home ventilation guidelines that you can find on our website at intensivecareathome.com. Eventually, this client found out about us, and also the hospital and the ICU that the client was in found out about us, and we were able to prove our concept with intensive care at home with this client within just a few weeks. When we worked with the client, we sent him intensive care nurses 24 hours a day, and he never ever went back into ICU ever again. And our concept was proven. And also we saved the funding body half of the cost than him going into ICU. We can do the same for you if you're not safe at home or if you are stuck in ICU, which includes the advocacy for funding that goes along with it. We have always successfully advocated for our clients, otherwise we would not be in business. This is also why we are providing level 2 and level 3 NDI support coordination. We have a team of NDI support coordinators and they have a wealth of knowledge. I've done an interview with Amanda Riches, one of our NDI support coordinators, and we'll put a link to an interview with Amanda in the written version of this blog. We're also providing TAC case management and WorkSafe case management in Victoria with Lucy McCotter. And if you're an NDI support coordinator or a case manager from another organization watching this, and you're looking for nursing care for your participants, please reach out to us as well. If you're looking for funding for nursing care for your participants and you don't know how to go about it and what evidence to provide, I encourage you to reach out to us as well. We can help you with the right level of funding and with the right level of advocacy. We're also providing NDI specialist nursing assessments done by critical care nurses with a legal nurse consulting background. If you're a critical care nurse and you're looking for a career change and you want to join a very progressive, dynamic, and high-performing team of critical care nurses in the community, we are already employing hundreds of years of critical care nursing experience combined, and you can join our high-performing team. If you're looking for a career change, we're currently hiring for jobs for critical care nurses in Melbourne, Sydney, Brisbane, in Albury, Wodonga, in Bendigo, in Geelong, and in Warragul in Victoria. If you have worked in critical care nursing for a minimum of 2 years, pediatric ICU, ED, and you have already completed a postgraduate critical care nursing qualification, we will be delighted to hear from you. I have a disclaimer. Because we are offering a tailor-made solution for our clients, which includes regular staff, our clients do want the same staff coming over and over again, because our clients are very vulnerable and very special. And that's why we need regular staff. If you're looking for agency work where you can come and go, this will not be the right fit for you. We are looking for consistency and our clients are looking for consistency. So please only apply with us if you can give us regular and consistent availabilities for shifts and you're really keen on building relationships with us and with our clients. And if you're an intensive care specialist or an ED specialist, we also want to hear from you. We're currently expanding our medical team as well. We can also help you eliminate your bed blocks in your ICU and ED for your long-term patients with our critical care nursing team at home. We're here to help you take the pressure off your ICU and ED beds. And in most cases, you won't even pay for it. Even if you do pay for it, it is much more cost-effective than what you're paying for in ICU and ED. And we are freeing up your bed. And if you're in the US or in the UK, and you're watching this and you need help, we want to hear from you as well. We can help you there privately with private nurses and with one-on-one consulting. And if you're a hospital executive watching this and you have bed blocks in your ICU, ED, respiratory wards, etc., please reach out to us as well. We can help you there very fast. Once again, our website is intensivecareathome.com. Call us on one of the numbers on the top of our website or simply send us an email to info@intensivecareathome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share this video with your friends and families, and leave your comments below what you want to see next, what you think about today's topic, and what insights you have from today's video. Thank you so much for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.